Hi, Wendy. For the millions of Americans who suffer from heartburn, the signs are probably familiar, but what if it isn't just heartburn? There could be something else going on, and it can have more serious consequences. Heartburn symptoms can range from stomach pain to acid reflux to difficulty swallowing and more.
Heartburn means the burning or the pain that one may feel when acid is exposed to the distal esophagus.
But if the symptoms persist and worsen, they could be due to something known as GERD. Fairfax gastroenterologist Dr. Alan Blosser sees lots of cases of GERD every year.
GERD can be a broad spectrum of diseases, anywhere from cough and postnasal drip to swallowing disorders to esophageal strictures.
GERD stands for gastroesophageal reflux disease, and if it's not treated, it can be dangerous.
GERD can permanently damage the distal esophagus.
Sometimes it would just become a continuous, very strong burning that would last for days.
It got so bad for Northern Virginia resident Tom Gillette, he sometimes missed work and was barely able to eat anything. He lost nearly 50 pounds. Finally, a specialist put him on Prilosec, but the effects of that wore off.
Eating smaller, more frequent meals, limiting alcohol, limiting tobacco use, consuming smaller meals are okay for the short order and may be very good for the upcoming week, but in the long term don't seem to work.
And if over-the-counter or prescription medicines aren't working, Stretta is one option.
We actually take a balloon, which is called the Stretta device. We insert it via catheter, and with this catheter,
a balloon is inflated in the esophagus and plants needles into a valve called the lower esophageal sphincter. By heating it up, that causes the remodeling of the valve, and that allows the esophagus to relax and close more effectively. It takes about an hour, and patients can usually resume activities within a day after the procedure. Tom Gillette says he's been symptom-free since Dr. Blosser performed his procedure in 2015.
I am glad I had it done.
Stretta is just one way to treat GERD. There are other options, including something called the TIF procedure. A lot of initials here. TIF can also treat the underlying causes of GERD. For more information, go to our website or NBC Washington app and search GERD, G-E-R-D.
All right. Well, remember